Guys, how are you? I think so. You will be fine and enjoying good health. Today, I have selected a topic on dengue outbreaks occasionally occur in the continental United States. Dengue is common in the U.S., territories of American Samoa, Puerto Rico, and the U.S. Virgin Islands, and the freely associated states, including the Federated States of Micronesia, the Republic of Marshall Islands, and the Republic of Palau. Nearly all dengue cases reported in the 48 contiguous U.S. states were in the travelers infected elsewhere. In the United States, local dengue outbreak most recently occurred in Hawaii in 2015, in Florida 2017 to 2020, and in Texas 2013. Most outbreaks in the United States have been relatively small and limited to small areas. Because the types of mosquitoes that spread the dengue are common throughout many areas of the United States, local spread of dengue is possible. Globally, a vaccine to prevent the dengue vaccine is licensed and available in some countries for people aged 9 to 45 years. The World Health Organization recommends that the vaccine only be given to persons with confirmed previous dengue virus infection. The vaccine manufacturer Sanofi Pasteur announced in 2017 that people who receive the vaccine and have not been previously infected with the dengue virus may be at risk of developing severe dengue if they get dengue after being vaccinated. Dengue vaccine for U.S. territories and freely associated states in May 2019. Dengue vaccine was approved by the U.S. Food and Drug Administration (FDA) in the United States for use in children aged 9 to 16 years with laboratory-confirmed previous dengue virus infection and living in an area with endemic dengue. In June 2021, the U.S. Advisory Committee on Immunization Practices (ACIP) recommended use of dengue vaccine to prevent dengue in children aged 9 to 16 years with laboratory confirmed previous dengue virus infection and living in areas where dengue is endemic. The CD recommends dengue virus testing for anyone who lives in or travel to areas where dengue virus is transmitted and has recently experienced signs and symptoms of dengue illnesses. Signs and symptoms of dengue may include fever, headache, rash, body aches, and bleeding manifestations. Symptoms may be mild or severe. Severe dengue often requires hospitalization. Dengue can occasionally present with signs and symptoms of septic meningitis and syphilitis. Dengue virus testing is not recommended for asymptomatic patients. Pre-conception screening. Patients with symptoms consistent with dengue can be tested with both molecular and serologic diagnostic tests during the first 7 days of illness. After the first 7 days of illness, test only with the serologic diagnostic tests. Diagnostic tests for dengue and specimens less than 7 days after symptom onset, the molecular test will be done and the specimen types will be from serum, plasma, and the whole blood and cerebrospinal fluid. For dengue virus antigen detection, NS1 less than 7 days after symptom onset, and the specimen type will be the serum. And serologic test will be done when the symptoms are less than 7 days, and if the symptoms are more than 7 days post symptoms onset, then the serum cerebrospinal fluid will be taken as a specimen, and from the tissues it will be taken if the symptoms are less than 7 days after symptom onset and if more than 7 days of post symptoms onset. So the tissues will be from the sample would be from the fixed tissues. Testing cerebrospinal fluid is recommended in suspect patients with central nervous system clinical manifestation such as encephalopathy and aseptic meningitis. Acute phase, initial 1 to 7 days after symptom onset. The initial 1 to 7 days after symptom onset are referred to as the acute phase of the dengue, and during this period dengue virus is typically present in blood or blood-derived fluids such as serum or plasma. Dengue virus RNA can be detected with molecular tests. The non-structural protein NS1 is a dengue virus protein that also can be detected using some commercial tests. A negative result from a molecular or NS1 test is not conclusive. For symptomatic patient during the first 1 to 7 days of illnesses, any serum sample should be tested by an AAT or NS1 test, and an IgM antibody test. Performing both molecular and IgM antibody or NS1 and IgM antibody test can detect more cases than performing just one test during this time period. The individual allows diagnosis with a single sample. Then is the convalescent phase, more than 7 days post symptom onset. The period beyond 7 days following symptoms onset is referred to as convalescent phase of the dengue. Patients with negative NAAT or NS1 test results and negative IgM antibody tests from the first 7 days of illness should have a convalescent sample test for IgM antibody test. During the convalescent phase, IgM antibodies are usually present and can be reliably detected by an IgM antibody test. IgM antibody test dengue virus can remain detectable for 3 months or longer after an infection. Patients who have IgM antibodies against dengue virus detected in their serum specimen with an IgM antibody test and either have a negative NAAT or NS1 result in the acute phase specimen or without an acute phase specimen are classified as having a presumptive recent dengue virus infection. Then a special consideration must be taken. Cross-reactivity is a limitation of dengue serologic tests. Serologic tests to detect antibodies against other flaviviruses such as Japanese encephalitis, St. Louis encephalitis, West Nile, yellow fever, and Zika viruses may cross-react with dengue viruses. This limitation must be considered for patients who live in or have traveled to areas where other flaviviruses co-circulate. Therefore, a patient with other recent or past flavivirus infections may be positive when tested to detect IgM antibodies against dengue virus. To more precisely determine the cause of infection in IgM positive patients, the IgM positive specimens can be tested for specific neutralizing antibodies by plaque reduction neutralization test PRNT against the 4 dengue virus serotypes and other flaviviruses. However, PRNT does not always conclusively distinguish specific flaviviruses. Areas with co-circulating flaviviruses. For people living in or traveling to an area with endemic or concurrently circulating dengue, Zika, and other flaviviruses, clinicians will need to order appropriate tests to best differentiate dengue virus from other flaviviruses and may consult with state or local public health laboratories or CDC for guidance. And for pregnant women, if the patient is pregnant and symptomatic and lives in or has traveled to an area with a risk of Zika, test for Zika using NAAT in addition to dengue. Interpreting test results: if a NAAT or NS1 test is positive for dengue, a current dengue diagnosis is confirmed. If the NAAT result is negative and the IgM antibody test is positive, the laboratory diagnosis is presumptive dengue virus infection. Then prevent the dengue by avoiding mosquito bites. All 4 dengue viruses are spread primarily through the bite of an infected Aedes species, Aedes aegypti, and the albopictus mosquito. These mosquitoes also spread chikungunya and Zika viruses. The mosquitoes that spread dengue are found in most tropical and subtropical regions of the world. Following these tips will help you protect your partner, your family, your friends, and your community from dengue. The more steps you take, the more protected you are. Prevent mosquito bites. Dengue is spread to people through the bites of an infected mosquito. Mosquitoes that spread dengue by virus bite during the day and night. These types of mosquitoes also spread chikungunya and Zika viruses. The best way to prevent these diseases is to protect yourself from mosquito bite. Find insect repellent right for you by using EPA search tool and traveling. CDC's country-specific travel recommendations. Take steps to prevent mosquito bite. Take steps to control mosquito inside and outside your home. If you have dengue, protect others. During the first week of infection, dengue virus is found in the blood of an infected person. If a mosquito bites the infected person, the mosquito becomes infected. The infected mosquito can spread the virus to other people through bites. Not everyone infected with dengue gets sick. Even if you do not feel sick, travelers returning to the United States from an area with high risk of dengue should take steps to prevent mosquito bites for 3 weeks so they do not spread dengue to mosquitoes that could spread the virus to other people. Dengue vaccine for U.S. territories and freely associated states. A new dengue vaccine is now available for the U.S. territories of American Samoa, Puerto Rico, and the U.S. Virgin Islands and freely associated states. The vaccine is approved for use in children aged 9 to 16 years with laboratory-confirmed previous dengue virus infection and living in areas where dengue is endemic common. The vaccine is not approved for use in US travelers who are visiting but not living in an area where dengue is common. Protect yourself from your family from mosquito bites. Use Environmental Protection Agency registered insect repellents with one of the active ingredient below. When used as directed, EPA registered insect repellents are proven safe and effective even for pregnant and breastfeeding women. Find the right insect repellent for you by using EPA's search tool. Tips for babies and children. Dress your children in clothing that covers arms and legs, covers strollers and baby carriers and mosquito nettings. When using insect repellent on your child, always follow label instructions. Do not use products containing oil of lemon, eucalyptus oil, or paramenthol diol PMD on children under the age 3 years old. Do not apply insect repellent to a children's hands, eyes, mouth, cuts, or irritated skin. Adults spray insect repellent onto your hands and then apply to a child's face. Tips for everyone: always follow the product label instructions. Reapply insect repellent as directed. Do not spray repellent on the skin under clothing. If you are also using a sunscreen, apply sunscreen first and insect repellent second. Natural insect repellent not registered with EPAs. We do not know the effectiveness of non-EPAs registered insect repellents, including some natural repellents. To protect yourself against mosquito disease by mosquitoes, CDC and EPA recommend using an EPA registered insect repellent. Choosing an EPA registered repellent ensures the EPAs are evaluating a product for effectiveness. Visit the EPA website to learn more and wear long sleeve shirts and long pants. Treat clothing and gear. Use 0.5% permethrin to treat clothing and gear such as boots, pants, socks, and tents, or buy permethrin treated clothing and gear. Permethrin is an insecticide that kills or repels mosquitoes. Permethrin treated clothing provides protection after multiple washings. Read product information to find out how long the protection will last. If treating items yourself, follow the product instruction. Do not use permethrin product directly on skin. Take steps to control mosquitoes indoors and outdoors. Use a screen on windows and doors. Repair holes in screens to keep mosquitoes outdoors. Use air conditioning if available. Stop mosquitoes from laying eggs in or near water. Once a week, empty and scrub, turn over, cover or throw out items that hold water such as tires, buckets, planters, toys, tools, bird baths, flower pots or trash containers. Check for water holding containers both indoors and outdoors. Then we have remembered to pack the following items: EPA registered insect repellent, external long sleeve shirts and long pants. Mosquitoes may bite through thin clothing and gear such as boots, pants, socks, tents treated with 0.5% permethrin. You can treat their own items or purchase permethrin treated clothing or gear. Mosquito net if you will be sleeping outside or when screen rooms are not available. Keep mosquitoes out of your hotel room or lodging. Choose a hotel or lodging with air conditioning or window and door screens. Use a mosquito net if you are unable to stay in a place with air conditioning or window and doors screen, or if you are sleeping outside. Sleep under a mosquito net. Sleep under a mosquito net if you are outside or when screen rooms are not available. Mosquitoes can live indoors and bite during the day and night. Buy a mosquito net at your local outdoor store or online before traveling overseas. And choose a mosquito net that is compact, white, rectangular with 156 holes per square inch and long enough to tuck under the mattresses. Permethrin treated mosquito nets provide more protection than untreated nets. Permethrin is an insecticide that kills mosquitoes and other insects. To determine if you can wash a treated mosquito net, below the label instructions. Follow the instructions. Use mosquito nets correctly. Mosquito nets can be hung above or bed or crib to protect against mosquito bites. Adults and children should keep under a mosquito net if air conditioned and screen rooms are not available. Tuck the net under the mattress to keep the mosquitoes out. Tuck netting under the crib mattress or select a mosquito net long enough to touch the floor. Pull that tightly to avoid choking hazard for young children. Check label instructions for additional information. Hook or tie the sides of the net or to other objects if they are sagging towards the sleeping area. Check for holes or tears in net where mosquitoes can enter. Do not hang the net near any candles, cigarettes or open fires as it can catch on fire. Do not sleep directly against the net, as mosquitoes can still bite through holes in the nets. Now, then about the transmission of dengue. Dengue virus are spread to people through the bite of infected Aedes species mosquitoes, Aedes aegypti or Aedes albopictus. These are the same types of mosquitoes that spread Zika and chikungunya viruses. These mosquitoes typically lay eggs near standing water in containers that hold water like buckets, bowls, animal dishes, flower pots, and vases. These mosquitoes prefer to bite people and live both indoors and outdoors near people. Mosquitoes that spread dengue, chikungunya, and Zika bite during the day and night. Mosquitoes become infected when they bite a person infected with the virus. Infected mosquitoes can then spread the virus to other people through bites. From mother to child, a pregnant woman already infected with dengue can pass the virus to her fetus during pregnancy or around the time of birth. To date, there has been one documented report of dengue spread through breast milk. Because of the benefits for breastfeeding, mothers are encouraged to breastfeed even in areas with risk of dengue. Dengue through the infected blood, laboratory or healthcare setting exposure. Rarely, dengue can be spread through blood transfusion, organ transplant, or through a needle stick injury. Dengue outbreaks are occurring in many countries of the world, in the Americas, Africa, the Middle East, Asia, and the Pacific Island. Anyone who lives in or travels to an area with risk of dengue is at risk for infection. Before you travel, find country-specific travel information to help you plan and pack. Almost half of the world's population, about 4 billion people, live in areas with the risk of dengue. Dengue is often a leading cause of illness in areas with risk. Dengue has emerged as a worldwide problem since 1960. The disease is common in many popular tourist destinations in the Caribbean, including Puerto Rico, Central and South America, Southeast Asia, and the Pacific Islands. In the United States, local cases and the limited spread of dengue does occur periodically in some states with hot, humid climates and Aedes mosquitoes. Now, the role of education and training. Dengue Clinical Case Management Course. Program description is the course is designed to increase knowledge and develop competency in the management of patients suspected of infection with dengue virus. Objectives are at the conclusion of the session, the participant will be able to describe the ways in which the dengue virus is transmitted, identify 3 potential complications during the 3 stages of the dengue, state the dengue case definition, list the risk factors for severe dengue, describe clinical features of dengue, name the 2 diagnostic tests needed to diagnose the dengue, list the 3 key steps of assessing a patient with dengue, describe treatment options for patients with dengue in the different phases, including cases and complications. So, the minimal prerequisite skills and knowledge for participants should include, but are not limited to, basic knowledge of human physiology, infectious disease, and human immunology, basic ability to interpret laboratory results, and understanding of patient care and management, clinical or hospital-based care, epidemiological concepts, and public health infectious disease surveillance. Each of these skills and knowledge sets are consistent with training certifications. So, Dengue, what the health professionals need to know, which will identify the vaccine storage, handling, and administration, describe the importance of interpersonal collaboration in public health settings when addressing the dengue prevention by the vaccination. The Centers of Disease Control and Prevention designate this vaccine to be approved for dengue fever cases. Dengue. Everyone can help mosquito control. Professionals from local health departments or mosquito control district develop mosquito control plans, perform tasks to control larvae and adult mosquitoes, and evaluate the effectiveness of actions taken. Your neighbors and the community can also take steps to reduce mosquitoes in and around your home and in your neighborhood. Additional information can be taken as well from CDC, Center for Disease Control. So this was all about the dengue fever. So I hope so that this information will be very helpful for you. And if you have liked my video, then don't forget to subscribe my channel. And thank you for listening my video, and have a wonderful nice day. Thank you very much.